You're thinking about getting chin lipo to get a better jawline, but have you considered the risks of this procedure? Today we're going to talk about the 6 risks specific to chin lipo, say that 5 times fast, maybe even 6, that I discuss with my patients so that they are fully informed before getting their procedure done. Remember, the risks of these things happening are very small, but you still have to know about them. So first up is scarring. To do this procedure, we need to make 3 tiny incisions, one under the chin and one behind each ear. I do my best to try and keep these incisions as small as possible by using a 2.5mm circular scalpel and then putting a small stitch in each incision to help them heal as small as possible. Sometimes these scars need to be lowered down behind the ear, so they might be noticeable after they heal. But for the vast majority of patients, these scars heal so well that they end up looking like a small skin blemish. Some people, though, will have darker scars because of their genetics, and unfortunately, that isn't something I, as your surgeon, have a lot of control over. But what we can do is keep those incisions out of the sun and apply sunscreen daily for at least a year after the surgery to make them as stealthy as possible. The other type of scarring is internal scarring, which is what we need and also what we need to manage. Internal scarring is what happens beneath your skin after chin lipo. It's the sheet of scar tissue that we want to help tighten up your jawline post-op by letting that scar tissue contract, so that way we get a nice new contour of your jawline. But if we don't massage it to keep certain areas soft, then we can get areas that are firm to the touch or don't stretch when moving your neck, so it becomes more noticeable. To prevent that, you need to do a lot of massaging, and that makes you mildly to moderately uncomfortable for about 3 months post-op in order to make it soft enough so that it shouldn't be an issue. Another risk is contour irregularities, otherwise known as lumps and bumps in your neck. Now, these lumps and bumps are going to happen regardless, and we talk more about that in our post-op massage video for chin lipo. But if your surgeon does not go back and break up all the remaining fat after it's been sucked out, then you have an increased risk of having these irregularities post-op. I approach the neck from 3 different locations so that we can cross-hatch the directions from which we remove the fat. These 3 different directions also allow me to go back and break up all that remaining fat from these different directions as well and decrease our risk of contour irregularities post-op. If you do develop some contour irregularities, that can sometimes be smoothed out with aggressive massaging over the coming weeks to months. On the other hand, there is a small chance you could need a revision if that does occur. Another risk is the risk of not meeting your expectations. Now, this is a tough one because you may have an idea in your head of what it should look like about 6 months later when you look in the mirror. But there are going to be some of you that are going to wish you had even more definition or that the surgeon took more fat. Unfortunately, chin lipo can only go so far because it targets the superficial fat in the neck. There's a deeper fat pad that's below the platysma muscle in the neck, and that sometimes needs to be addressed. But even if this fat pad is addressed, then you can run the risk of having too much fat taken out. When too much is taken out, then you develop what's called a cobra neck deformity. This is usually seen as a depression in the central neck region and is more of a risk in older patients that get chin lipo alone. The other risk of taking too much fat is that the platysmal bands can be more easily noticed in older patients. So contrary to what some of you might think, we can't just suck out all of the fat in your neck. You do need some of it to help keep a good contour to the neckline. Infection is another risk, and it's a small risk with this procedure. Just like any surgical procedure, infection is always a risk in any surgery that we do. But when using sterile techniques and with the use of antibiotics, we can decrease that risk to a pretty low level. We don't ever make it to 0% chance of infection, but it's pretty low. Anytime we do facial surgery or in the neck region, there's always the risk of causing facial nerve injuries. Surgeries like neck lifts, facelifts, brow lifts, all these surgeries have risks to nerves in the face, and chin liposuction is no different. There are 2 nerves in particular that we need to watch out for during chin liposuction. The first is the greater auricular nerve just behind the ear, and that gives sensation to the ear itself. This nerve is very superficial and runs just behind the ear near where we're going to be making our incision for the liposuction port. There is a chance that we could bump up against this nerve with a liposuction cannula, and it could lead to some temporary numbness of the ear for a few weeks to a few months before it comes back. The other nerve is the more worrisome one, and it's called the marginal mandibular nerve. And this nerve allows you to pull down the corner of your mouth, kind of like when you're making a frown, kind of like that. But it can also lead to an asymmetric smile. So it runs along the bottom border of your jawline and then crosses back up to innervate the muscle called the depressor angularis. It actually sits below the muscle that we're working above called the platysma. When this nerve is injured, you can have an asymmetric smile due to the muscle not working correctly. If this nerve gets bumped up against, it could be weakened for a few months, sometimes up to 6 months or more. If it is directly injured, or even worst case scenario gets cut, then it could be a permanent injury. But in the hands of an experienced surgeon who knows the anatomy and is using safe practices, then the risk of this is very small. But what happens if you get home and you have an asymmetric smile? Did the nerve get injured? Not necessarily. Most likely what's happened is that the numbing medication that we use has indirectly affected the nerve. This causes you to have an asymmetric smile for a few hours until the medication wears off. It might be a little scary in the beginning, but your normal, beautiful smile should be back in a few hours. If it doesn't come back or get better in a few hours after surgery, be sure to call your surgeon to let them know your concerns. Next up is the risk of bleeding. Now, the risk of bleeding during and after chin liposuction is pretty small, but it's one that I take seriously because we're relying on the adrenaline in the numbing solution to squeeze down the blood vessels and make them as small as possible to decrease the risk of bleeding. After the surgery, we use the compression garment to keep enough pressure on the area to decrease the risk of bleeding. With this procedure, there's no way to stop any internal bleeding with a stitch or with a cautery, so we have to mitigate those risks by watching out for the risk factors. Things like high blood pressure, bleeding disorders, blood thinners, ibuprofen use, and alcohol use all increase the risk of bleeding during and after the surgery. Chin liposuction in general is a safe procedure in the hands of an experienced surgeon. But if you are still concerned about some of these risks, at least now you have some basic knowledge of them so that you can have a more meaningful conversation with your surgeon. And if you want to have an even better idea of the areas that need to be treated during chin lipo to get great results, then you can watch this video right here where we talk about the 4 areas that I focus on to get you a better jawline. I'm Dr. Paul Pearce, and I hope you learned something today. I'll see you in the next video.